What's up, everyone? Cyclops with Paramount Cyclops, and this story kind of more deals with what is your threshold? At what point do you live and not live? At what point do you allow others to live and not live? At what point do you say you have locked down enough and you haven't locked down enough, and then different levels of people's lockdown within the same community? According to this story and public opinion, if we are to take this story at face value, if you work as a nurse or in any kind of health field, then you must lock yourself down, never leave, never see your family. You must always wear a mask, never go anywhere, and never come in contact with anybody whatsoever, or you risk getting fired. I mean, I'm taking it a bit further and just a tad bit hyperbolic, but not by much. So let's read this from the Daily Mail. An Oregon nurse is put on leave for boasting that she doesn't wear a mask, keeps traveling, and, oh my God, she lets her kids go on play dates. Horrible! Horrible! That's right, you're supposed to take your children and never leave the home. Let them just grow roots. Pour water on their feet, tell them not to move, and they'll just grow roots. A nurse from Oregon has been placed on administrative leave after she posted a TikTok video that made fun of basic measures designed to curb the spread of coronavirus. Okay, parents out there, how many of you are actually not letting your kids do anything? They are never going anywhere with you. They're not coming in contact with anybody. How many? How many? Raise your hands. Comment. Are you on total lockdown? Have you placed your family on absolute total lockdown? Because evidently the mob will come for you if you are not. The original post has since been deleted, however, and another user made a copy of it and reposted it on their on their profile as a duet. So everybody that is complaining about this nurse who isn't locking down, are you locking down? Are you wearing a mask at all times, 24 hours a day? Are your kids never leaving the house? Are you never traveling anywhere? Everybody who has traveled for Thanksgiving, not one of them better be a commenter who comments about this, because they're doing the same thing. We can't have rules for thee and not for me. I mean, that's precautions. If she goes to the hospital and she sanitizes and she wears a mask while she is in the hospital and she uses proper precautions in the hospital, then there you go. Those are proper precautions. What do you want? What do you want? Imagine being an oncology nurse during a pandemic and bragging about not taking precautions, they wrote. Imagine having a life and living. What did we do before this with the flu and with all these other infectious diseases? We didn't do all this. We didn't tell nurses that they had to be completely locked down and their kids to never have play dates. So remember this, nurses and healthcare professionals. If you have a family, you may as well just give up your family. Because from now on, until the eradication of COVID, until the eradication of the flu, until the eradication of the cold, until the eradication of literally everything that is an infectious disease, you can never see your family. Your kids can never go on play dates. You must always wear a mask all the time for the rest of your lives. And you can never, ever, ever, ever travel anywhere. This logic being applied equally, that's what it says. The original video posted by user at loveiskind05, evidently she is not kind, because she seeks to destroy someone else's life for living, saw a nurse dressed in scrubs, complete with stethoscope in what appeared to be a hospital break room, with the caption, "When my coworkers find out I still travel, I don't wear a mask when I'm out, and I let my kids have play dates." Okay. She wears a mask when she's in a store because, well, you're not allowed to be in a store without a mask, so we know that she wears a mask when she's in a store. So what? You want her to wear a mask when she's outside and there's nobody around, I'm guessing? And not travel? What happens when COVID ends? We have to apply this logic equally now. Now that you have let the cat out of the bag, this logic must be applied equally. So the flu, until the flu is eradicated, the cold, until the cold is eradicated, no healthcare workers' kids can have any play dates. No healthcare worker can ever travel, and no healthcare worker can ever not wear a mask. I'm just using the same logic and applying it equally, that's all. Equal logic. That's it. Equal application of the logic. The nurse was identified by BuzzFeed as Ashley Grahams. Yes, because everybody must have a mob come after them. Yes, we must name and shame everybody who does something remotely against what anybody else says. Who became a certified nurse? Who cares? Yes, she's been a certified nurse for a while. And then she became a registered nurse for a while. That's fine. But why? Why do we intrude on people's personal lives like this? I guarantee you none of these people here that are commenting and grabbing their pitchforks and going after her, I bet they don't follow the rules like that. I bet they have traveled. I bet there's times when they didn't wear a mask. I bet if they have kids, they have let their kids play. Equal application. Equal application, right? The caption that the nurse travels, does not wear a mask, and lets her kids have play dates goes directly against guidelines from the Centers for Disease Control and Prevention aimed at stopping the spread of the virus. Everything we do, living, goes against the CDC's prevention guidelines aimed at preventing the spread of the virus. Do you social distance yourself from your kids and your wife at all times? Do they social distance themselves from everybody at all times? If they don't, then we're going against the guidelines. Do you wear your mask at all times? Then you're going against the guidelines. Everybody that traveled, we had a big travel weekend. So evidently, 67% of the population is going against the guidelines. But yet we're going to focus on this individual. Only because it's COVID, though. Only because it's COVID. But if we apply the logic equally, it doesn't make sense. You want every single healthcare... We'd never have a healthcare worker. You want to be a healthcare worker, you'd have to be single and never have a family and never want kids. What? Come on now. The CDC that suggests less travel, not no travel, wearing masks around others when social distancing, not all the time, not 24 hours a day, when social distancing is not possible, and avoiding get-togethers with people outside your household. But that's impossible. Every time you go get food with people out of your household, you go do anything outside of your household, you're around people outside of your household. It is impossible to live life completely social distanced. It's impossible. But the apparent frank confession by the nurse led to users scrambling to identify her. Grab your pitchforks! Get her! Get her! She has a life! She has a life! And then, of course, they had to notify her employer, Salem Health. Because, of course, they did. What else are they going to do? I'm not social distancing. I'm not wearing my mask. What? A healthcare worker has a life outside the hospital? How dare her? Although the company did not name Grahams as the nurse involved, they did say that a staff member had been placed on administrative leave pending an investigation. And even that wasn't good enough because people were still saying, investigation, you should fire her. Should we use that same logic against you, those who are calling for her firing? Shall we come to your job place and nitpick and see if you are following literally every single guideline? And if you are not following a guideline, we should fire you? Where are we headed? What are we coming to? Is this what we're doing? This is where we're headed? This is what we want to do with our time? As long as she is sanitizing or whatever you do before you go into the hospital and gloving up and wearing a mask and wearing a bunny suit or whatever it is that she needs to do in the hospital and following the proper procedures in the hospital, then fine. Because nobody can possibly, to the letter, follow all the procedures. If you go into everybody who works in the hospital on their private life at some point, they've gone somewhere, they've done something. Their kids have seen someone. What are we doing? Equal application of logic. Take your feelings, step back from a situation, and look at it from a perspective of, does this really make sense? See if it makes sense. And if it makes sense, let me know in the comment. Yeah, it makes sense. They should fire her. I mean, if that's your opinion, stick to it, you know. Nothing wrong with it. Everybody's entitled to their opinion. It's a great thing about this country. The great thing about this country is everybody's supposed to be entitled to being able to have life, liberty, and the pursuit of happiness. But I think we've forgotten all that. Yeah, it's just words on a paper anyway, right? None of that really matters, does it? I love you guys, and I'll see you on the next one.